All right, everybody. Before we start today's press conference releasing another portion of our budget, I just received our COVID numbers for the day, and unfortunately, they are a new record and certainly not in a good way. Today, we'll be reporting 11,232 new cases, an all-time high, a positivity rate of 27.39%, an all-time high, 21 new deaths. So please be careful, get vaccinated, get your booster as quickly as you can, and wear a mask. All right, good afternoon, everybody. Today, I continue to unveil pieces of my upcoming budget recommendation. The recommendation is titled, Our Future is Now. Over the last few days, I've talked about how we, as Kentuckians, have arrived. After a record-breaking year, one where we shattered every economic development record in the books, we are the talk of every boardroom across America, and every country now not only knows who we are and where we are, but what we can do. But having arrived, we have to make the investments, we have to do the work to stay on top. On Monday, I discussed how these investments and the work we must do starts with education. My budget recommendation invests record funding, nearly $2 billion extra in education, creates universal pre-K for all four-year-old children, provides much needed raises for our educators, loan forgiveness for our teachers, and begins to address the mental and emotional needs of our children. It also funds higher education and scholarships at the highest level in decades. Yesterday, I focused on how to keep our economic momentum going, how to turn 2 incredible years of economic progress into 20 years of great prosperity for our people, how we seize this moment to ensure world-class companies like Ford, Toyota, Fidelity, GE Appliances, Pratt, Kruger, and so many more continue to bet their futures on our people. Yesterday's budget pieces included a site development fund to enlarge and ready new and existing sites to land the next big deal. It included record investments in water and sewer infrastructure, in roads and bridges, in broadband, and in electric vehicle infrastructure. It included a state-of-the-art agritech R&D facility in the heart of Eastern Kentucky, a life sciences lab in Northern Kentucky, and necessary funding for the Barkley Airport in Western Kentucky. Yesterday's recommendation outlined how we invest in workforce programs like the CDL training that can be offered by the Louisville Urban League, and how we take our state parks and tourism to a whole new level. I'm pleased today to discuss other important pieces of my upcoming budget. And I want to go back to the title of our budget to introduce this piece. Our future is now. When we say our, it must mean everyone. Inclusion, the idea that everyone counts, is a value, but it's also rooted in my faith. The book of Luke tells us, for the Son of Man came to seek and save the lost. What more powerful message can there be than Jesus being sent to earth, not for the wealthy or the pious, but those that are hurt, those who suffer, maybe those who just need a little more help and a little more opportunity. And that the Son of Man told us the most important commandments were to love God and our neighbor, and that everyone is our neighbor. Since March 6th of 2020, we've been reminded of this teaching in some pretty painful ways. The great lesson of COVID is that everybody counts, that we are all connected. And if we don't look out for everyone, give them the tools that they need in a pandemic to survive, then we all suffer. So, as we've been saying, whether it's the pandemic or moving forward in our Commonwealth, if we want to get through this, if we want to do this, we got to get through it and do it together. That same lesson applies to our historic economic momentum. We cannot reach the next level or stay on top if we leave some of our own people behind. Just look at our workforce issues. By not ensuring more people are healthy, more people have childcare, more people have the skills they need to thrive, we find ourselves having to act to make up for lost time and opportunity. Put simply, caring about our people. Ensuring opportunity and caring about our people is good business, and it's the right thing to do. By increasing access to services that support our families, children, and our communities, it means we have more healthy people that can participate in our workforce. And that starts with a basic human right: access to high quality, affordable health care. That's why I made good on my promise to relaunch Connect, our state-based health insurance exchange. Enrolling in a Connect health plan has made some of the most common medical visits less costly, which is part of our larger plan to improve private health insurance for Kentuckians. And because we again have our own state-based marketplace, we have the flexibility to do what we did for those impacted by the December storms and tornadoes. We were able to extend enrollment with a special enrollment period that now continues through January 31st. Kentuckians who qualified for the special enrollment period were literally able to sign up on New Year's Eve and have peace of mind on New Year's Day with the knowledge that they had health care coverage. It's only because we have our own state-based marketplace that we have the flexibility to help Kentuckians year-round or in their time of need. Here are more ways we invest in our people in our upcoming budget recommendation. Medicaid. Healthcare is a basic human right, but in a pandemic, we've seen it's a difference between life and death. We must continue to ensure that every Kentuckian has some form of healthcare coverage. And so, in addition to Connect, we must build on options like Medicaid, which 1 in 3 Kentuckians rely on for their healthcare coverage. That includes 661,741 Kentucky children, children of God that deserve a healthy start to what we hope are amazing lives. It is an urgent need, which is why my budget fully funds the Medicaid program, including Medicaid expansion. It also funds hundreds of additional slots in the Michelle P. Waiver Program and 100 additional slots for the Supports for Community Living Waiver Program. If you have a child who needs one of these slots, you know how amazing the services are, but you also know the pain of how long the waiting list is. Investing in our nurses. A priority in my budget is also investing in those who care for our people during our times of need. In this case, Kentucky's nurses. In December, I signed an executive order to combat nursing shortage in the Commonwealth to help boost enrollment in nursing training programs. While this was a start, COVID and the unprecedented surge we're seeing from Omicron shows us the critical need to do even more. So in this budget, I provided $6 million each year to significantly increase the number of scholarships awarded to those who go into nursing programs. This is a much needed increase from the current scholarships, financed by a portion of nursing licensing fees, which only award to about 150 students. My budget will significantly increase the number of students participating, and it doubles the maximum award currently provided of $1,500 per semester up to $3,000 per semester. That is a huge difference to students who want to pursue this path, but worry about the cost of doing so. So this helps get nurses into the profession. We also have to keep our existing nurses in the profession as well. Simply providing dollars for bonuses will not work, as traveling organizations can simply pay more and then charge the additional costs that they've incurred to the hospitals that simply require their services and don't have a choice. So my budget takes a more effective approach, one based on longer-term retention. Starting in May 2022, my budget would create a student loan forgiveness program that would provide up to $3,000 annually for each year a nurse or nursing faculty member is employed in and stays in their position in Kentucky. This is a 5-year program, meaning someone becomes a nurse or nursing faculty and stays in that job for 5 years. They could get up to $15,000 of loan forgiveness through this state program. Additional scholarships and loan forgiveness are big steps, and they will work. So we need to get the word out about this great career and these new benefits to further maximize the impact we can have immediately at shoring up our number of nurses. To help with those efforts, I'm proposing to use $2 million from American Rescue Plan Act state fiscal recovery funds to finance a marketing and outreach program for the profession. Many of these proposals were suggested by the Kentucky Nursing Association, who worked in close contact with us and also in discussions with the Kentucky Board of Nursing. And I will also include $400 million in one-time ARPA funds for hero bonuses to Kentucky frontline heroes. Those will include our nurses. Look, our nurses are the brave, compassionate healthcare heroes who care for our people. And sadly, some people disrespect them through their words or their actions. So let's take positive action to say in one clear voice that we love our Kentucky nurses. We want to support them, and we want more people to join their ranks. Today, we have a video from Lorraine Wilson, Chief Nursing Officer and Vice President of Patient Services for St. Clair Healthcare in Moorhead.
On behalf of St. Clair Healthcare and the many healthcare organizations across the Commonwealth, and on behalf of the 70,000 nurses within the state of Kentucky, thank you, Governor Beshear. Make no mistake about it, nurses are warriors. We're fighting for the lives of those we serve. We serve our patients in healthcare institutions, their homes, and in their communities across this Commonwealth. We serve families as they bring new life into the world and as they transition from this world. We are servants and warriors of caring and of hope. But these warriors are tired. They're exhausted. The pandemic has shown us that while we're good at what we do, mandatory overtime can only continue for so long. And with the shortage like it is, we have got to have people who are willing to step into those shoes and continue that fight. We're unique and we're powerful, and we're the most trusted profession in America. We know that, we realize that, and we want to keep that streak, we want to keep that going, but we have to have replacements. Our nurses are tired. They not only care for people here, they care for one another. We're caring for God's children, and we know that, and we're proud of that, but we have to have replacements. The generations of young folks that are coming on right now, nursing is the #1 profession you need to consider. We care about people, we care about this community, we care about this state, and we know that our governor does too. Thank you, Governor Beshear. The investments you're making today will ensure that there's a steady workforce of nurses who are able and willing and proud to care for the people of the Commonwealth.
Thank you to Lorraine. And listen, especially in that hospital, they know how hard it's been. And she's still there along with her crew every single day, working to help people. Really special people. Next, nursing homes. My budget works to take care of the most vulnerable. COVID has hit our nursing homes hard, taking far too many lives and taxing staffs to a level that none of us have seen before. It's caused burnout and sometimes too little staffing for the level of care that's needed. So my budget extends the reimbursement increase of $29 per day to these groups, representing $150 million annually to nursing homes. And our nursing home workers, they ought to receive hero pay too. And they are certainly within our $400 million recommendation. They are brave workers who have seen unimaginable hardships and far too much death during COVID-19, and they need our support. Local health departments. Something else we've learned and continue to learn in this pandemic, the important and amazing role of our local health departments. From testing to keeping people informed to administering vaccines and boosters, our health departments are the front lines to helping our people daily. I'm not sure there's a group I've gotten to know better in this pandemic than members of health departments all across Kentucky. Listen, they were amazing before this, doing so many important things like the HANDS program or other health initiatives. But what they have done in this pandemic, the way that they have risen up for us and stepped to the front lines, something so dangerous, has been nothing short of incredible. So my budget is stepping up for them. I'm recommending more than $36 million through fiscal 2024 to transform our local health departments. These funds will be allocated to the 60 departments across the Commonwealth to help with staffing and workforce, as well as operations to deliver the programs and services Kentucky rely on. And these heroes should be included in the hero pay too, and they certainly are in my recommendation. Mental health. As I've said many times, healthcare includes mental and emotional health. My budget targets two strategies to help in this area. The first is to fund the implementation of the 988 crisis support line effective July of 2022. This is a 3-digit number that's going to replace the National Suicide Hotline, make it easier for people to get help, and they expect it'll increase calls 56%. Think about that. These are calls by folks that may be suicidal themselves or family members that are desperately and immediately needing help for someone that they are worried would take their own life or need help. 56% more calls will undoubtedly save more lives. By providing support and directing help where it's needed, we can prevent suicides and save lives. My budget also includes $3.4 million in fiscal 2023 and $9.9 million in fiscal 2024 to phase in 170 additional staff to Kentucky's community mental health centers, and that will allow them to offer crisis support 24 hours a day, 7 days a week, 365 days a year. Think about those two in combination. And having an easy-to-call 3-digit line where more people are calling to get help, and then more people on the ground ready 24/7 to be there here in Kentucky to offer any help, any counseling, anything else that's needed. This will dramatically increase what's available to those in their greatest time of need. Also included in funding is to expand Tim's Law to 2 other psychiatric hospitals in the state, to Eastern State Hospital and Appalachian Regional Hospital. Now, I'd like to ask Secretary Friedlander, who is our Secretary of our Health and Family Services Cabinet, to give us a few comments, and then we'll go through the other pieces.
Thank you, Governor. Thank you for your continued leadership. Thank you for your continued focus on Kentucky's most vulnerable populations. These are important and historic investments. Investments in Medicaid not only provide health care to 1 in 3 Kentuckians, it assures that our healthcare systems, our hospitals, our doctors, our nursing facilities, all will continue to function. We've seen how important this infrastructure is. What's often overlooked with Medicaid is without Medicaid, our healthcare system in Kentucky would collapse. Investments in children, investments in behavioral health, investments in our local health department, and in seniors. For the first time, we have been able to eliminate waiting lists for seniors who need meals, who need nutrition. To continue this is what we absolutely need to do. So, Governor, thank you. On behalf of some of Kentucky's most vulnerable citizens, thank you. This is exactly what we need to do.
In addition to the healthcare efforts that I just laid out, we must also look out for the most vulnerable in Kentucky, like our children and our seniors. One of the most heartbreaking times of need is when a child faces a cancer diagnosis. Childhood cancer is the #1 cause of death by disease in children. It's always a devastating statistic for me to talk about, but this year it became personal to Brittany and me when David Turner Jr. died of brain cancer after an incredibly courageous battle. He's just 9 years old. You may remember that when we honored David in May 21st, 2021, it was David Turner Jr. Ice Cream Day in the Commonwealth. I remember the first time I met him, he came to my office and we put him behind the desk. We gave him a signing pen and we said, "What are you going to do? You're governor." And he said, "It's going to be ice cream day." And I saw him so many times after that, even when things were getting tougher and he couldn't talk to me like he did that day. We want to celebrate his life and his spirit just as I think he would have wanted us to, and to make every day the best day ever. So in my budget, I'm going to try to make it a real good budget day for kids like David Turner Jr. In my budget, I'm increasing funding to the Kentucky Pediatric Research Trust Fund. It's an important investment that will help move forward research and treatments to produce better outcomes so that hopefully no family ever has to go through what David's has. Child abuse. If we're going to live out our faith and especially serve the lost, the lonely, and the left behind, we must do more to address both child abuse and domestic violence. That is why my budget includes a 34% increase in funding to domestic violence centers, rape crisis centers, and child advocacy centers. These centers not only help during the immediate moment of need, some of them, like child advocacy centers, assisting in investigation and prosecution, but they help start a process of healing right then and right there. They help to work towards that healing where hopefully people can come back from horrific trauma to live healthy, full lives. Their work is critical, and we cannot, and I will not, overlook their services and the impact they have on our people. In addition, my budget includes additional funding of $19.6 million each year to sustain and expand prevention services that work with families to mitigate issues when a child is at immediate risk for removal. In other words, almost $20 million each year to try to step in and make sure children never reach that unfortunate moment where we have to bring them into a child advocacy center or when they come into a domestic violence center with their parents. If we could step in and prevent things from escalating to that point, think about the impact that we will have on those lives and maybe next generations. Residential and therapeutic foster care rate increases. Another area where I'm making a critical investment is in residential and therapeutic foster care through a 17% rate increase for those providers. These organizations serve children who will require the highest quality care and aren't able to be placed in a family-based setting. Child and adult care. Just like we discussed on Monday, the need for child care has never been more important. But this discussion also must include senior care. So many Kentuckians struggled for far too long in silence, balancing the responsibilities of either caring for their children or their older loved ones. But the pandemic exacerbated those struggles and the conversations became louder, and it's clear more help was needed. So this budget invests both in child care and adult care, something our families and our workforce need to thrive. It includes a $2 per child per day increase in child care assistance program funding and funding to support a new Office of Dementia Services and the Kentucky Caregiver and Heart-Supported Living programs. Senior hunger. Our secretary may have beat me to the punch on this one. Just like our children, our seniors need and deserve help in times of need. Now, I'm a bit ashamed that I did not know before this pandemic that we had a waiting list for seniors that were going hungry in Kentucky. That's right. We had a list of how many seniors couldn't afford regular meals and needed our help, and we weren't reaching all of them. But the pandemic freed up funds and allowed us to change it, and during COVID, something that has been a challenge to get through, we've actually been able to provide more help and serve meals to every single one of those seniors on that list. We should never have a waiting list for seniors who are going hungry to get help ever again. Worse, the waiting list was about 7,000 meals. So we're not going to let it happen again. I'm proposing $36.2 million a year over the next 2.5 years to provide an additional 49,000 meals per week, which fully meets the needs of our Kentucky seniors. Caring for our veterans. Kentucky's military veterans represent the best of Team Kentucky, and we have a sacred duty to meet their needs. That's why my budget includes an additional $200,000 each year for homeless veterans programs. It includes $700,000 each year to increase the numbers of veterans benefit field representatives so they can get out there and get people the benefits they're already entitled to and deserve, and nearly $300,000 each year to expand outreach. Other priorities in my budget include helping our veterans to boost staffing at our 4 veteran cemeteries right now, not having enough staff for the number of internments that are coming. We've got to make sure that we are there, especially at a time of grief for families, delivering for those that have fought for us. And also, it includes funding, and it's not a lot, but it's important, to create a permanent memorial honoring Kentucky Medal of Honor recipients at the campus of Freedom's Foundation in Valley Forge, Pennsylvania. Right now, we have a fiberglass obelisk. Most states have done the right thing and replaced one with granite or stone. It's time that we made sure that we are honoring our Medal of Honor recipients in the right way at that honored location, and this budget will do just that. Finally, my budget includes $1 million in fiscal year 2024 to phase in operations at the newest State Veterans Center in Bowling Green. Put simply, these investments aren't just in the support and services offered, they are investments in our people. If our future is now, the only way we meet it is together, where nobody is left out, and we provide the services needed to get people on their feet, to get productive, to get back in the workforce, where we live out our faith and values, where no senior or child should ever go hungry. And like I started this press conference in saying, it's not just the right thing to do, it's good business. At a time when our economy needs more workers, by getting our people healthier, by providing the necessary child care, by addressing those issues that have scarred people and trying to get them on a path of healing towards healthier lives, we can do right by our population. We can also do right by our economy. It's a pretty special moment in our history. We're doing the right thing, is doing the smart thing, which is doing the thing that's going to help us build even better for our future. It's a Kentucky value, taking care of our neighbors, and this budget makes it a top priority. All right, we'll open it up to questions. We got 3 journalists here and 4 on the line. We'll start with Mike.
Thank you, Governor. You've spoken in the past how you believe the pandemic has laid bare the racial inequities in the healthcare system. Is there anything in your budget that addresses that?
Certainly the pandemic has laid bare racial inequities in our healthcare system, and we have worked through the pandemic to address them, everything from extra outreach to getting people signed up for health insurance options or Medicaid that they already qualified for, to being very direct and intentional in where we set up testing and vaccinations. We are now very close to our overall percentage of vaccinations to Black and African-American Kentuckians at 7%, and the total population at 8%. Remember, that's still having 10% other, which is we still got to delve into if it's possible, because that's much higher than the census numbers. In moving forward, we certainly have some economic development initiatives like the Louisville Urban League, CDL training initiative, but we've also, I believe, built into our own Medicaid programs and other programs in the cabinet ways that will work each and every day to address those inequities. I also believe the Everybody Counts initiative that we have started in Jefferson County should directly give hope to some communities that have lost it, and trying to ensure employment of our young individuals, where far too often young individuals from disadvantaged communities don't end up with jobs right after graduation. Bodie Brooks.
Can you explain a little bit more about the mental health hotline? And did I hear that correctly, how it would replace the national hotline? Explain that a bit more.
So this is something that's happening all across the country. You know, the National Suicide Hotline is a 1-800 number where you put it all in. That's being moved. States across the country are adopting it to a 3-digit hotline, kind of like 911, where there's going to be extensive federal advertising about it so that it gets ingrained in our consciousness, just like 911, or it used to be 411, that we would use for different ways. That number is 988. So from now on, anybody who needs help, all they'd have to do is dial 988. Family members who need help for a loved one, all they have to do is dial 988. They don't have to look up that National Suicide Prevention Lifeline, which none of us know the number if we don't. And they've shown across the country that it increases number of calls significantly. So that's one piece. And it's a national push, and it's one that we are rightfully funding, and the House budget does too. The other piece is building up our own workforce that is around the state to help at that point. So you get a call, but people need some in-person help and response 24 hours a day. That's the second piece that's right there. That's the 170 additional staff to the Kentucky Community Mental Health Centers across the state that can take that intake call from the 988 number and have somebody there in the community providing the services that are needed. We think it can make a big difference. Karen.
With the COVID numbers where they are, will you be virtual small or in chambers? And then kind of piggybacking on both of those questions, there seems to be a lot of more focus on mental health, especially as the pandemic started. It used to be the disease you don't talk about. Lawmakers on both sides of the aisle are really putting this in the forefront. How do you think that shift happened?
Well, first, at this time, I will be giving the budget address in person. With Friday canceled for the General Assembly, there will probably be fewer legislators there, which is okay. Everybody ought to make the best decision, and everybody who is going to be in a large room together ought to be masked. Mental health, I believe, our a newfound focus on it actually goes back to federal health care reform, where the Congress passed that mental health shall be treated just like physical health. I thought that was an incredible breakthrough. That was a watershed moment. And even though much of our supermajority opposed that federal health care reform, at that time, they passed a bill last session that recognizes in state law. I actually believe they passed the bill maybe even before the pandemic hit, or right in that 2020 time period, that recognizes that as a matter of state law. So I think it was already moving that direction. When you look at our kids, yes, the pandemic's hard on them. I'd argue social media is also incredibly hard on them. I keep thinking back in school when somebody would say something nasty, you thought everybody knew. And now you can put it online where millions or billions of people can read it. I think telehealth has been revolutionary in that now you can, from the comfort of your home, if you're worried about stigma or going out, have an appointment right there. And I think we've seen courage of a lot of people speaking out about difficulties and just needing a little help. And there's nothing wrong with needing a little help. We all do from time to time. Bria Jones, WFPL.
Do you have any update about the situation at the prisons around the state that were dealing with COVID outbreaks that you mentioned at last week's Team Kentucky meeting?
So much better than we initially believed. It shows that wastewater testing works and works early. I think we had at Kentucky Correction Institute for Women, as of yesterday, as of Monday, what is today, Wednesday? As of Monday, we had 2 positive inmates and 10 positive correctional officers. Now we are still doing testing with Omicron. That's going to grow. It's going to grow. If you're not vaccinated, your chances of getting Omicron are really high. If you're vaccinated, your chances are significant, but your odds of having severe disease are very low. But much less than we expected. Corinne Boyer.
Does your budget include any funding for health insurance for people who don't qualify for Medicaid, but who can't afford market rate insurance?
Let me ask the secretary to address that one. The connect options, I guess.
Couple of answers to that question. One is certainly with Connect and moving to the state-based exchange, we've given folks more opportunities to afford insurance. A lot of folks talk about the benefit cliff because of that gradation. We are able to provide coverage to a lot of different folks. We are, under the governor's direction, looking at what a basic health plan might be in collaboration with the federal government. We're not there yet, but that is something that I think we are very interested in because healthcare is a human right.
Debbie Yetter from the Courier-Journal.
Thank you. Do you know how your health and human service spending compares to the budget plan filed last week by the Republican leadership? And if there are differences, what do you foresee doing about it?
Okay, let's put up that slide. What I'm showing right now are things that are in our budget that aren't in their budget, or that there are more in our budget than theirs. Nursing scholarships, that's $6 million, is not in the House budget. Nursing loan forgiveness is only in our recommendation. The extra senior meals, pediatric research fund increase, there is what's normally given in their budget. The family caregiver program, there's more. Heart supported living program, there's more. They may have a few more Michelle P. No, we have 100 more? Okay, we have 400 more Michelle P. waiver slots than the House does. We have an Office of Dementia Service, Veterans Affairs, pieces that are out there as well. Listen, the House has some things that we've talked about, and good when they're there. Certainly, we support anything, any of our values that they fund more than we do. We're in favor of it. Now, I'm going to ask actually John Hicks, if he can, to again talk about how we have significantly more recurring revenue than we do recurring expenses. So we can actually afford, from everything we have seen, to do every piece of my budget recommendation and everything that the House may fund at a higher level. In other words, we have the ability to responsibly, fiscally, do it all.
Yeah, thank you, Governor. Let me add to that point. This budget, the governor's budget, devotes non-recurring resources to non-recurring uses. And you've heard many examples in the last couple of days from the governor about that. It is more than structurally balanced. What we mean by that is our recurring expenses are less than our recurring revenues. By $1 billion in the fiscal 23 and almost $600 million in fiscal 24. And what that means for the following biennial budget is that we'll start that budget with resources already available, recurring resources, even before we take into account any increases in revenues. And let me also add that this budget is real and responsible and is based on sound economic assumptions that are agreed to by our 10-member consensus forecasting group. It's a group of economists and financial experts who set our official revenue estimate, and we're the only state in the country that has a body entirely consisting of outside experts. This budget, in addition to being fiscally responsible, pays down on the Commonwealth's largest pension liability, one of the worst funded pension plans in the United States. Not only are we paying the mortgage, the actuarial determined contribution, the governor's putting $750 million more into that plan. That's one-time money for a one-time use. We're building up the Budget Reserve Trust Fund. It's the largest ever in Kentucky's history, and the governor is adding to it. We're paying down another type of debt, a debt of deferred maintenance. Kentucky's state government has a large physical plant particularly in our post-secondary education institutions. And this governor's budget is putting up to $1.2 billion in one-time money into that deferred maintenance debt. It also establishes a disaster recovery and relief fund. Kentucky has always relied upon our rainy day fund when we have responses to disasters like the tornadoes in Western Kentucky. And the governor puts $100 million into a fund to start using that as a resource to respond to disasters rather than using our rainy day fund. And lastly, in terms of the amount of debt, we have a state policy in Kentucky where our debt service, our principal and interest payments, are no more than 6% of our revenues. Well, in this governor's budget, that ratio is down to 3.68%, the lowest ever since the inception of that policy. Governor?
All right. And our last question, Melissa Patrick, Kentucky Health News. Thank you, Professor Hicks.
Hi, Governor. I have just a couple questions, and some of it has to do with the sustainability of your nursing home, putting $150 million. And if you can kind of explain what that means, to add $29 a day, is that sustainable, or is that a short-term plan? You know, is money going to be given that is not guaranteed forever? And then my second question is, it sounds like you've talked to nursing leaders about what they want. Are these scholarships and loan forgiveness programs, are these like their top two things they're asking for?
So when we've had discussions with everyone from heads of hospitals and universities. This is something very similar to what Pikeville is doing with Pikeville Medical Center. And we've had discussions with the Kentucky Nursing Association, some of which we were able to do, some of which we actually encouraged them to push harder for. We've had conversations with the Board of Nursing. These are taking all of them together, but then addressing some of the economic barriers of getting into nursing and the economic barriers of staying in nursing. You know, nursing is a little bit different because most of these folks aren't working for us than social workers and teachers, which we also have loan forgiveness for, whereby when we lost the real pensions for new hires, we lost the number one retention method that we've seen where people would stay for 20 or 30 years. I think these were in the top 4 or 5 of the request, if they were not the top, but they were also the ones that overlapped from everyone. The payments, the extra payments, the $29 go through 2024. And we'll see at that point how sustainable it is moving forward. Certainly, there are huge additional costs with COVID, and nobody is arguing that piece. And we want to, especially in the midst of a pandemic, do our part. This was the top ask of the industry. There were lots of others, but this one was the one where they said, if you do this,